पे बुलाना चाहता हूं एक ऐसे डॉक्टर को जो हड्डी से हड्डी तो जोड़ता ही है, पर अब डॉक्टर और डेंटिस्ट के इस गैप को भी ब्रिज करेगा।
Hello. He is an orthopedic surgeon and health educator and author to the best-selling books and the co-founder of NutriByte Wellness. He is, ladies and gentlemen, he is none other than Dr. Manan Vora. Can we have a huge round of applause for Dr. Manan on stage, please?
Thank you guys. Hello. Hi everyone. Can we get some energy, guys? Okay, so I didn't know this was supposed to be a solo talk. I was just informed a few minutes ago, so I'm going to just be very candid, be very organic, and just have a 20-minute chat with you guys. I was speaking to a lot of dental students and dentists out there who have started their content creation journey, or they've always thought about starting it. So quick raise of hands. How many of you already are dental content creators? Okay. How many of you have wanted to start but have not gotten that final inspiration and probably came here and registered here thinking that this is the push you're going to get? Anyone here who's not started yet, or is everyone already posting something or the other? Okay. We had a few people who raised hands when they said that they're dental content creators. How many of you post something, whichever platform you're posting on, more than 4 times a week? Okay, fewer hands, but at least we have these many. Okay, great. So I'm just going to address a few things that, came up outside. Let me tell you a little bit about myself. I'm an orthopedic surgeon, was very much actively doing my stuff. During COVID, in the second COVID wave, as an orthopedic doctor, I stop making money if there's a lockdown because people stop getting out of the house. You don't fall, you don't get hurt. People stop playing sports so they don't get injured. So I found myself having a little bit more time than usual. And that's when I started scrolling on Instagram and I saw a makeup influencer and a travel influencer make videos on COVID. And I was like, wait, why are they doing it? Because obviously they knew that everyone wanted COVID information. And that's when it struck me that why are doctors or people in the healthcare space not starting something like this, or why are they not making such videos? And that's when I just started my camera and started making a couple of videos, and I started getting traction very, very fast because people were really hungry for health information, really hungry for COVID information. So that's how my journey, just started. And since then, I haven't looked back because the benefits of starting, my page and starting to talk about health have only gotten me to different places. For example, this stage over here, this wouldn't be possible if I hadn't put myself out there. And I know I don't need to really convince you guys about why you need to start. I think most of you already know that. But just to give you an idea, your personal brand, your personal identity will take you to a place where you did not imagine you could go, right? As healthcare professionals, this is not something that we generally think of when you're doing your education, you're doing your PG, or you're just starting off practice. You never really thought that you need to put yourself out there, but you need to understand that this is just what is needed right now. So quickly, let me just ask you guys, can anyone name a few brands for me? Anyone? Name a brand? Sorry? Yeah, so he's named his company. What about you? Nykaa. Any other brand? Okay. Any other brand? Apple. Lovely. Any other brand? Sorry? Hermes. Choices are very expensive. Okay, so we had Nykaa, we had Hermes, we had Apple, we had a lot of these brands. Not a single one of you named yourself. You named your company. What did you say? Your page name, right? I wanted to name your name. What's your name? Yeah, so I need Dr. Shefali to be a brand, right? So each one of you needs to look at yourself as the brand and your offering as the product. You need to stop thinking that, oh, मैंने clinic page खोला है, मैंने dental ये खोला है, that needs to be something. Always, your name needs to be a brand today, and you need to make your name a brand today, for which you need to put yourself out there. Right? So I was speaking to a couple of people outside, and I was jokingly saying that I've seen a few dental pages and all they have, or most of it, is pictures of teeth, right? You guys have to show your before and after smile makeovers and all the results. And I told them that whenever I come across a page like this, I never hit the follow button. Okay? Now I do understand you guys have to show your results, but try and understand that when you're speaking on social media and you're showing these videos, you are actually addressing the common man. the common man who doesn't necessarily like to be ill, doesn't necessarily like to see things in a hospital, in a clinic, or finds most of these things disgusting, right? Which is why on my page, I generally never show anything related to the OT, or I don't, of course, there's a lot of consent issues, which is different, but I won't show a lot of blood because people will just be like, oh my God, why did you show this? Right? So please try and understand, and I'm not saying you shouldn't show your results, you shouldn't have testimonials, you shouldn't do that, that's okay. But do keep in mind that make yourself the brand. Make it almost impossible for the person visiting your page to not find you interesting. Because they will come to you if you are interesting as a person and if you are really communicative, and that first barrier of fear is broken because you're getting a chance to project yourself. Okay, now all of you have been to doctors in the past or dentists or any healthcare practitioners in the past. I think you'll agree with me that earlier we never used to even know how the doctor looks, right? The first time you visited them, fine, thoda Google Pay photos and all started a recent while ago, but we used to actually open the door and see the person over there the first time, and our parents used to take us, or back in the day. You're getting a chance now to create an impression before someone walks into the door. They need to know how you look, they need to know how you talk, they need to know how you are, they need to know how warm they would feel to be vulnerable in front of you, and you are getting that chance on social media, and you can't take that lightly. That is the personal brand that you need to create. That is the identity you need to have, right? So even when we get a lot of patients via social media, they're just coming in after seeing even senior people than me, but the first thing they say is, I just feel you will listen. That's the feeling I get when I see your page. I just feel that you'll be good at listening, because most of the practitioners I go to, they're not listening. They're giving me 3 minutes, they're giving me 5 minutes. They're not giving me the amount of time. That's the feedback I get from my patients. And then I do deliver on that, because that is the identity I have created. So you need to create that brand around yourself, whatever your strength is. You could be a good speaker, you could be a good listener, you could be, of course, you need to be excellent at your work. If your skill is not good enough, they're not going to come back to you. That's not my point. But all of us have spent 5 to 8 to 10 years improving that skill. So that is there. But what is the differentiating factor? I'm pretty sure in dentist competition, to zyada hi hai, right? Because literally every lane has a couple of dentists now. I can't even say one dentist per lane. It's literally a couple of dentists per lane. So how are you going to stand out? How are you going to tell the opposite person that, hey, I am different and you'd rather come to me than someone else? Your skill may be equal to them. Heck, your skill may be lesser than the person sitting next to you. But if you create that impression on your page and with your personal brand, you will go a very, very long way, right? The other thing I had a couple of people ask me is that, how do you get the time? How do you do this, right? Now, how many of you have faced that as an issue, right? That you're too busy and you're not getting time to make videos, or not getting time to put yourself out there. Is time a factor, or all of you have time and there are other issues? Quick, raise of hands. Is time an issue? How many of you? That's it? So the rest of you should be having very, like one post a day, so should be going only. But okay, so honestly, there's no shortcut to that, right? You have to put in the hours. We have AI now to actually help us with a lot of the process. I know there are a lot of social media agencies that actually are pitching their services, especially to dentists and doctors and the healthcare field in general. And you can take their help wherever it's required. What I will tell you all is that you don't really need to have the most perfectly shot or the most perfectly edited video that you're extremely proud of, and only that will go up. You'll be surprised to know that a lot of the raw and authentic stuff actually resonates with people and actually works, right? So it's something as simple as a simple tripod, a simple phone, a basic mic. You can start making videos, you can start talking, and you will realize that you get better and better with time. Right? I had one dental student ask me that, how do I start when my first video looks like this? I had someone else tell me, your setup looks so fancy, and my setup is the most basic. But the idea is that just start, right? You'll finish your first 50 videos. You'll go ahead, you'll look back at your first 50 and say, oh my God, I could have done so much better. That's normal. No one has it sorted from video number 1. If you go to my first video, 500 videos below, it's almost embarrassing. I actually showed it to someone outside. It's hilarious. I couldn't believe I made a video like that. But everyone starts somewhere. So just put yourself out there and start, right? The next thing, I had someone very specifically tell me that I really want to speak about maxillofacial surgery because it does not get enough importance and it does not get enough this. You guys need to understand that while you all have a niche, while you all have a specialty, while you all have a particular offering, please understand that on social media itself, health is a niche. Now you're going into oral health, which is already a sub-niche. Now you want to go one step further and speak about, whatever your branches are, OMFS or whatever other branches are, that is too specific, right? It's okay to obviously talk about it once in a while, but please understand oral health itself is a very untapped market on social media, and it's a very untapped sub-niche in itself. So please try and speak about a broader aspect, cater to a broader audience, and subtly integrate what you are a specialist in and what you actually deal in, and that's when those will filter in. You need to understand that every person viewing your page or every person watching your content is not going to convert to a patient or convert to a customer. So the only way for you to reach lakhs of people is by speaking slightly broader. And when I say slightly broader, oral health is not technically broad. It is a niche in itself, but broader than just one particular subspecialty that you've done your PG in or the services you have to offer. Only when you speak to a broader audience by choosing topics that are broader will you get more and more attention, more and more eyeballs. And then when you have certain services to offer or drive people into your clinic, that's when more people will know where you sit and they'll probably come to you. So if you pick a very, very particular niche of a particular procedure that you do, I see now this Invisalign is a big thing, right? In your space, I have all my dental friends keep posting about it. That's too specific. That's too specific, right? When I watch that, I'm not interested. But if someone makes a video on how to ensure you don't have bad breath before you go on a date, all of a sudden that's a little more of an interesting topic that appeals to more people, right? Now, only when you make a video like that, there is a chance that that video gets 1 million views and it filters down to at least 1 lakh people coming to your profile and seeing your page. It filters down to about 1,500 people hitting the follow button, and it filters down to about 50 people trying to find out where your clinic is, and it filters down to 5 people coming to your clinic. That is not possible unless you make a video that appeals to a massier audience, that appeals to more and more people. Yes, now this is a little different on YouTube because YouTube is a search-based platform. So if you make a particular video about a particular procedure on YouTube, chances are someone already diagnosed with something, suffering from something, is searching that on YouTube and trying to find that video because they've already been diagnosed with something. So always remember, YouTube, search-based platform. Instagram is more trendy, more viral oriented. Instagram pe you have to give people information that they didn't even know they wanted to know. Whereas YouTube pe you have to be a little more specific. You can obviously cross post between platforms, but since Instagram is generally the first step that people take before going into long form video, do keep in mind, be a little more broad, be a little more massier, and you will attract more and more people. Now coming to another thing you need to keep in mind is that when you prepare a particular script, all right, you obviously have ChatGPT to help you now and it becomes easier, but you have to ensure it is as concise as possible. Now, when I say that, it means that more information may not necessarily be better. Okay, how does the platform work is there is something known as average view duration. You all know what that term means? It's the amount of seconds the average viewer is spending on your video. So if your video is 1 minute 15 seconds and your AVD is about 17 seconds, it means that most people left the video in 17 seconds, right? All of us are using our thumbs and scrolling on reels non-stop. You have to grab the person's attention. Now, if your first 15 seconds were interesting and after that it wasn't, you've already lost the person after 15 seconds and your video was 1 minute 15. Now, 15 seconds is a very small part of 1 minute 15, right? It's just 20%. But if your video about the same topic was a little more concise and was of 36 seconds, and your first 15 seconds was still as interesting, you had the audience's attention for about 45% of your video, which means the platform will push that video a lot more. So keep in mind, more information doesn't necessarily mean better video, right? You must have seen a couple of these videos. Some people put a 7-second audio and say, read in caption for more details. And that video has a lot of views because it's used a trending audio. It's only 7 seconds. It's only captured people's attention. How many people are reading the caption? I don't know, but that video will always have more views. That's because people ended up watching 7 seconds out of 7 seconds. So that's where the AVD actually helps. So keep in mind, keep your video as concise as possible. Read your script, reread your script and ask yourself, is this line really important? Does this line add value to the eventual message or is it a waste? If it's a waste, cut it out. Every second you save can actually help your video get more traction. Now coming to the main concept, right? A lot of people say, yaar, ye information ke bare mein to sab video bana rahe, yaar, what can I do differently? You need to understand there are three main components that you need to address, and at least try to get 1 out of the 3, if not 2 out of 3 right in each and every video. The first question you need to ask is, am I providing value in this video? Is there any value or not? The second thing is, does my video entertain anyone or not? And the third is, does my video evoke any emotion in the viewer? These are 3 points you have to ask yourself. Any value? Is it entertaining? Is it evoking any emotion? When I say value, it means that are you giving a practical tip, or are you busting a myth, or are you sharing something that is social currency? What is social currency? Now, if you watch a particular video as a consumer, let's say non-health related video, right? Like how to save your taxes this year. You want to share this with 5 people and appear smart in a social setting because you shared this. That is social currency. So does your video add value in the sense of social currency? Do you want someone watching it to share it with a group of people and say one of 2 things, that, hey, I told you this is how it is, right? Generally we see something relatable and we share it with someone and say, remember, I told you this, see, this person is saying it's actually true. Or it's the other way around, where they say, oh my God, did you know this? Because either the person sharing it knew it or they didn't know it. So are you adding any sort of social currency, and is the value actually going to change the way someone goes about their day-to-day life or not, is the value point. Second, and this applies little lesser to the health space, but still we have a lot of good creators adding entertainment in some way or the others. Is it entertaining? At the end of the day, Instagram is a platform that people use for entertainment. We all have to accept that, whether we like it or not, right? When do you open Instagram? You're quickly traveling, you'll open Instagram. You're bored at night in the bed, you're opening Instagram. You're waiting to go into somewhere, you have 20 minutes free, you're opening Instagram. That's not the case with YouTube. Most of you will agree that in these situations, you open Instagram and not YouTube, right? But if you want to open YouTube, you're going to search something like Sri Lanka 7-day vlog, for example. Or if you've taken your parent for a knee appointment to an orthopedic surgeon and they've said, oh, they need knee replacement, you're not going to open Instagram. You're going to open YouTube and check what are the complications of knee replacement surgery. You're going to certainly check that. So YouTube is open at a very, very different time. Instagram is open at a very, very different time. The psyche of the consumer is to get entertained on Instagram. So you have to ask yourself, does your video entertain? Now, it's a very difficult thing to do during health, right? I've tried it myself. I currently don't even do it. I don't answer this question on my content currently. I used to at one point. But that is something you have to ask, is that, can you entertain? You can't force entertainment because then the average view duration will go down. It has to genuinely be entertaining. And that would add a significant unique factor. And the third one is, can you evoke emotion? Now, what does that mean? That does your video make the opposite person either happy, either sad, because sad is also good? Does it leave them in awe? Because that is good. Does it create fear? I shouldn't say it, but it's actually good. Fear mongering, up to an extent, if it's medically accurate, works as well. I use that very often, as long as I'm not crossing a line and creating unnecessary fear. Any of these emotions, awe, excitement, happiness, sadness, fear, whatever it is, anxiety, nervousness, all these are emotions that you're evoking in an audience, and that will make them share those videos as well. So these are your 3 points. The next time you prepare a script, ask yourself, is there value? Is there entertainment? Is there emotion? And you need not have all 3. It's very difficult to have all 3. My suggestion would be to aim for at least 2. Now, coming from the healthcare content space, generally value is a no-brainer. I mean, you can technically not have value as well and do very, very well. But value is a no-brainer, especially if you're running a personal page and you want to be credible, you want to be known as a thought leader in your space, you need to have value. But then one of the other 2 has to be there, whether you bring in entertainment or whether you evoke emotion. And when you get 2 out of these 3, you concise your script well, you have decent amount of editing, and you're coming across as confident on screen, that is when your videos will start clicking. Right? So that was one thing I wanted to let you all know. I don't think I have too much time, last couple of minutes. What I will suggest, because I see a lot of dentists running their social media page from a clinic page. Is that right? Is that what most of you do? Your page's name is either your clinic username or it's very out there that this is the clinic page and this is the dentist. I will strongly recommend, please have a personal page. Jiske bio mein your clinic ka page is also there, that's fine. But have a personal page in which you are yourself as a person. The chances of that growing are far more than a clinic page. Yes, having a clinic page is okay, where you can show your dental before after pictures, you can have patient testimonials, you can have success stories, you can have everything over there. For someone going to that page and saying, oh wow, this they've already done this much, it's established, this is the address, I'll go and visit them. But expecting a dental clinic page to grow, it's not impossible, but it's much, much tougher. Expecting a personal page to grow in which you are yourself, you are authentic, you are showing that you are just as much as a human as the consumer, has a higher chance to grow. And yes, that does to some extent involve sharing few details about your personal life also. I know not everyone is comfortable with it. Hello? Okay. Hello? I don't know if that was my cue to that my time is up, but I'll just take a couple of minutes more. Yeah. So, I can't tell everyone to share things about their personal life. That's not my point. But do understand that the person watching the video wants to know that we are just as much normalized and humanized as possible, right? You have to appear as relatable as possible, which can involve showing things about your life that makes the opposite person find you interesting enough to come visit you, right? So please do keep that aspect in mind. At the end of the day, the audience wants to see a personality. They don't want to see before after teeth pictures. I'm sorry if I'm going on repeating that, but I find that very repulsive when I visit a dental page. And I don't mean to, insult the process that you guys go through to obviously get those results. That's not my point. But try and be interesting as an individual. Try and be interesting as a personality. Your skill and your results are there. People will come for that. People will see that. But to grab eyeballs, everyone wants to grab eyeballs here, right? Today, at the end of this day, 50 people start an account and start creating dental content. That's you're already competing with 50 people. So please remember, be as raw and authentic as you can. Show your true self, show your true personality, and give value along with either entertainment and emotion or both, if you can find a way to do that. And you will be unstoppable. This is all I can give you in 20 minutes without any preparation. I hope it was of some use. Thank you so much. I'll be out for a few minutes if anyone wants to meet me. And I'll be happy to chat with you guys. Thank you so much to the Dental Spotlight for having me. And thank you.
Thank you so much, Dr. Manan. Can I please invite Dr. J to kindly come on stage and felicitate Dr. Manan. Ladies and gentlemen, a huge round of applause.